what I was going to say is when I did my initial training in China, I was in Chongqing and Swining for about 6 weeks. And then when I came back to South Africa, Chongqing provided me with excellent teachers who worked with me for 1 year until I was competent enough to be able to do it on my own. So I couldn't have done it without Chongqing support.
So you have somebody sitting next to you for almost a year.
Yeah.
Ooh.
I had 4 different doctors. Each one came for about 3 months at a time. We worked together, and after a year, when I was competent, they left me on my own.
Okay. All right. Okay. Hugo, you have anything else to ask, or ask anybody? Especially you want to ask. You were saying you're going to torture Dr. Olarik with your questions. Hugo, I can't hear you. Your mic.
Okay. Better?
Yes.
Yeah. So, well, that's what I expected from Raymond, of course, because my very limited experience tells me without initial help during the 30, 41st cases, you cannot, it's impossible to do it. And I know South African patients that are disasters, those patients. So I'm very happy to hear how Raymond did that.
We don't see a lot of adenomyosis in our black population. Of the
really?
Yeah.
Is that
we
true?
see a lot of it in the white population, but we don't see much in the black population. So we've treated, I think, only probably about 20 patients with adenomyosis, and the results we got were very good.
So, Raymond, are you saying that adenomyosis in South Africa is much more, how should I say, relevant in the white population as in the black population?
Yeah, the same with endometriosis. We hardly see any endometriosis in our black population.
No, adenomyosis.
Yeah, no, but I'm saying both adenomyosis and endometriosis, mainly in the white population. We hardly see it at all in the black population, but then fibroids are extremely common in the black patient.
Oh, I didn't know that. So that's interesting.
So we don't have much experience with adenomyosis. We've only treated about 20 patients with adenomyosis.
Black patients.
Black patients.
May I share something?
Okay, sure.
Yeah, please. All right.
Yes. Okay, I think for the adenomyosis, it depends on the goal of the treatment. Okay, for the treatment for the pain or the abnormal bleeding, I think the HIFU is like a tool to like destroy the lesion. But after that, I agree with Dr. Ali to use some medical treatment to suppress and to protect the recurrence of the adenomyosis. Because we know that if the patient has the estrogen, the disease can come back. So in my opinion, I don't have the experience on HIFU, but I think after treatment with the HIFU, we have to give some hormonal treatment lifelong until her menopause. This is my opinion for treatment of pain and abnormal bleeding. But for the patient who has the infertile, I think the treatment is big difference because we try to get the pregnant is very early, as soon as possible. So I think the strategy is very different between two sides of the patient. This is my opinion.
Yeah. Any more questions or comments?
Yeah. We have 2 questions from chat room.
Sure.
First from Victoria Rowena CC. She asked about the cause of the HIFU procedure for adenomyosis in Chongqing Hospital or in Singapore. Maybe Dr. Keen can answer the question, the cause.
Okay, sure. the cost of the treatment of adenomyosis and the patients, I think most of us have done in Singapore, usually is covered by their personal hospitalization insurance. So ballpark figure, anything for a short procedure, a simple adenomyosis to somebody who has to do it for 3 hours and all this varies from, let me see, I have to think in terms of Singapore dollars and convert. Okay, it is something like US 15,000 to US 25,000 ballpark figure. Really depends, all in ballpark figure, including MRIs and blood tests and all. But you must understand, even an MRI in Singapore costs about US $900. And I understand in Chongqing, they can do MRIs before the procedure, immediately after the procedure, and then 3 months, 6 months, 9 months, and a year. But we can't afford to do MRI for follow-ups. That comes to the question of, especially I'm going to ask Raymond, do you use MRI for follow-up? Because after that, I normally just do one MRI for patients who can afford, and I just follow up with just pelvic ultrasound.
So we do one post-treatment MRI at about 6 months. We've only got one MRI machine for the entire hospital.
Okay. What about ultrasound? Ultrasound follow-ups? Do you do that?
Well, we do ultrasound follow-up. So we do ultrasound at 1 month, 3 months, 6 months, 12 months, and 24 months.
Sure. That leads me to what I have always been thinking. Why don't we use 3D ultrasounds, like what we use for babies, pregnancies and all this? Why are we using 2D ultrasound? So this is a question I'd like to pose to everybody. Has anybody thought of using a 3D ultrasound for follow-up? Okay, if not, then is there another question?
From from Vishnu Sharyawan, I think it's from Indonesia.
Mm-hmm.
He asked about what happened with the ablated tissue. I saw they created a space hollow in the uterus. It can be resolved spontaneously over time. Maybe you can answer the question, Dr.
Okay, sure. I just saw my teacher Zhang Lian on the line, and I think Raymond can answer that too. So maybe Zhang Lian, you try to answer the question first, and then we come back to Raymond. Then I'll give my 2 cents worth. Zhang Lian, have anything to say?
Yeah, I'm here. Yes. So yeah, about the complications, HIFU treatment right now at this moment, I think is really safe. So the complication rate is very low. So the most common complication is about the skin burn. So when the patient had like the previous surgery and the abdominal scar, so then for this kind of patients may have a higher risk to get the skin burn. So during the treatment, so we can we have the protocol. Like for example, when we solicate for 50 seconds, then we have decreased the transducer and slow down and check the skin. Then we do it again. So for this kind, follow this kind of protocol, it's like the skin burn, the rate is like the 0.1%, something like that way. So now it's very safe about this.
Okay, Raymond, you have anything to add to that?
Yeah, just adding on to what Leanne said. I mean, that's why it's done under conscious sedation. The patients will warn us if the skin is getting hot. So we will then take precautions, and that's how we prevent it. So if they tell us the skin's getting hot, we'll lower the transducer, we'll stop treatment, we let the cold water come into contact with the abdominal wall. Yeah, so and in terms of complications, injury to bowel or other structures, we make sure when we're treating that we leave a margin of about 1 centimeter from the edge of the fibroid to allow for dissipation of heat. And therefore, because it's such targeted treatment, it's a very safe procedure. We have very low complication rates.
Well, let's come back to my learning curve. So, and that's why I always emphasize.
May I ask something, Professor Lee?
Yes.
Raymond, you say your complication rate is very low. Are you sure that the patients with complications are coming to you? Because you have patients from all over South Africa. They come to you, you treat them, and they disappear again in their villages. So if you have then complications later, how high is your loss to follow up for your patients?
We have got a problem. I mean? Yeah, no, for sure. Yeah. Plus, we have patients coming from across the borders as well. Yeah. But we probably patients that are coming from out of our Johannesburg area is probably about 10%. But what we do is when we discharge the patients, we give them a letter to their doctors, please to inform us that if there are complications, they'll let us know. But we do have a bad follow-up with some of our patients. Yeah. But we probably maybe we do lose some to follow up. Yeah. But of the ones that we see, the vast majority, over 90%, come back for follow-up. And there we know the only real problems we've had are 2 cases of superficial skin burns.
Oh, that's great. Yeah.
Okay.
Good. Thank you.
Thank you, Prof. Aili. There is some question from the chat room. How is the adverse effect on implantation after HIFU from your experience, implantation rate?
Actually, I'm busy typing the words to the message, and also Professor Zhang Lian answered this question. So mostly 2 side effects. One is bowel injury. We happened one at the first year. The second is skin injury. Am I right, Professor Zhang Lian? Two sides, yes, 2 aspects. One is bowel, skin, but it's happened very rare. If you had a very good procedure, keep the good reason like music or dancing, not to hurry, be careful. It will not happen forever, I hope.
How about for the implantation rate after the HIFU for the infertility?
Nearly at least 70%.
Okay.
Ooh.
Okay, there's another question here from the chat room from Dr. Melinda Rita. Question is HIFU appropriate for a 47-year-old with adenomyosis and a 6 cm funded adenomyoma? A patient doesn't want surgery.
That is a very popular situation. So many women, sometimes psychologically, the woman's heart is very hard to understand. So there is a very old saying in China, woman's heart like a undersea needle, Professor Lee, 女人心海底针. So mostly the woman wouldn't like accept surgery. So we have so many excellent surgeons. They can do the laparoscopically or types of surgeon very well. But mostly the woman wouldn't like accept any surgeon. They wouldn't like had any incision on the abdomen. So we have some actors and some models. They wouldn't like had any injury. So HIFU is a very good choice. No any incision, no bleeding, non-invasive, very gentle. The patient can talk with you. You can the patients can see some video, listening some music. So you can destroy the lesion very quickly sometimes.
Okay, there's another question asked whether is HIFU suitable for diffuse adenomyosis?
Beg pardon?
Is HIFU suitable for the patient with diffuse adenomyosis?
Very suitable. Unfortunately, I prepare very good case on my slide, so I'm not very sure what's happened on my computer. So it's very good for diffuse. It's like electrical curve can ablate all the lesion.
But you must understand, Professor Aili, you know, when we do HIFU for adenomyosis or even for fibroids, we are supposed to leave a corridor of safety from the serosal layer of 1.5. So if it's diffuse, how are you going to treat the adenomyosis that has reached the border of the uterus?
Yeah, we can treat the areas, the safety area we can treat, and after HIFU, we can use medicine to control the menstruation. So sometimes for very hard case, the choice is the menstruation and the uterus. So if you want to keep the uterus, just stop menstruation. So we call adenomyosis and the endometriosis like pelvic vampire. No bleeding, no menstruation, the disease can be stopped. So after HIFU, we can use some gospel, like I mentioned in my slide, unfortunately. So this kind of medicine, gospel, 棉芬, is very magic medicine, can stop the woman's menstruation. So stop the menstruation, no pain. The uterus can be relieved. So what kind of big, huge lesion, it can be healed.
May I have ask some questions?
Okay, Olarik.
Do you think for the pre-treatment, I mean, give a GNRS agonist
Yes.
for HIFU? Is it easier to do HIFU because maybe the uterus is smaller? What do you think, in your opinion?
Yeah, that is very good question. At the beginning, especially for the very diffusion, big, huge adenomyosis, we use the GnRH 3 months, and then we do HIFU. But literally, we found it's not very good. So now we use after HIFU. The size of the adenomyosis, the more bigger is more safer for the patient, especially combined with DIE. Because very dangerous back posterior part of the uterus.
All right, can I just take a moment off, go back to the slides, since everybody is talking about pregnancies, and I show you, for those of you who wants to know what is the pregnancy rate like, this is taken from Chongqing. Already 1,500 HIFU babies, normal course of pregnancy, no incidence of uterine rupture. And I'm also very happy to announce in Singapore, well, my colleague, Dr. Hong and the rest of the team went to visit Chongqing HIFU Hospital and in 2018, and very glad to announce that Dr. Hong has successfully treated a lady with fibroids, and the lady is now a proud mother of a beautiful baby just 1 or 2 months ago, and that's Dr. Hong with the baby. So for anybody with any doubts about the effectiveness of HIFU and the complications of pregnancies, I really don't think so, because HIFU itself hasn't got a cut on the uterus. Let me continue. That's I'm very glad that Professor Wang ZhiBiao actually visited the HIFU Center in Farrer Park Hospital last year. I'm glad to host him and to show him what we have done for the hospital. And I have a heart-to-heart talk with him, and probably the first time I have the opportunity to talk to him about his experience with HIFU. You see, it is not the usual wine and dinner talk. I really grilled him, and it was the pouring from his heart of his trials and tribulations of his research, experiments, and commitment to HIFU. So if you walk around the compound of the HIFU hospital in Chongqing, you will notice there's a monument erected in honor or in remembrance of a HIFU pig dated 15th of August, 1997. So I would like you to hear a pre-recorded video, which he has specially prepared for us. When I asked him, please tell me the story of the HIFU pig. And with eyes full of excitement like a child, Professor Wang ZhiBiao told me this story. And you will understand it's a man with great commitment to medical science in search of an answer to alleviate the sickness of mankind. He sacrificed his youth, buried in his laboratory with his team, in pursuit of a belief that ultrasound energy is the next big thing in medicine. If he failed, he is a forgotten fool. But he succeeded, yet he kept his humble silence in one corner of China. He's a rare breed of great achievers to be admired, a one in a million. So I will show you the video here.
这个今天呢，我们在远程室看到哈这些图画，实际上全是数字化治疗，所以我们可以远程化。今天呢，这个很高兴哈，国际部这个有关这个由我们新加坡的李建威医生来主持的这个会议，我很开心。那么在这个会议这个中间呢，我来讲一讲这个海弗猪的故事。其实海弗猪呢，就是我们在研究这个聚焦超声呢，真正切肿瘤的一个刀尖呢，不是声学的刀尖，是生物学交域，是要在组织里面形成灵魂坏死点。这个坏死点随着刀头的移动，这个坏死点在移动，看到没有？这个概念哈，所以叫生物学交域。而这个工作到今天为止，我感恩大家，我们做了30来年哈，把这个问题解释清楚了。但是在解释这个问题上，以前呢，我们都是靠只要做一个焦点，觉得我们聚焦超声就可以切肿瘤。实际上我们走过了非常艰辛的路。早期在这个组织里面，不是我们这个聚焦超声就可以形成灵魂坏死点，是我们做可能有时候出现，有时候不出现，而且大量的不出现。那怎么来解决这个问题？我们实际上在经过了好几年的实验以后，突然有一天呢，这头猪啊，我们做的小型香猪，我们聚焦在肝脏里面的20个点，每个点都出现了灵魂坏死，一种理想的、完美的这个展示了刀尖的效果，每一个点都看到非常好的灵魂坏死点，边界很清晰，大小可控，哦，简直这个我们觉得是上帝的安排，上帝。因为我们的千辛万苦感动了上帝，所以上帝给我们回报了，给我们体现了这个结果。那么这头猪啊，是我们历史的转折，所以我们把它叫做海弗猪。那天我们一般猪做了实验以后解剖了，我们会把它还到我们的动物这个实验中心去。那天这头猪我们就没有，我们。大家跟这头猪啊，我们给它敬礼，给它默哀，因为它对人类医学，特别是聚焦超声治疗，是做出了巨大的贡献。而这个不是对我们团队的贡献，是对人类医学的贡献。所以我们给它竖了一块碑，然后我们上面就叫海弗猪，这个。概念就是这样来的，所以因为海弗是海弗这个团队，实际上真正的从专业上应该是对聚焦超声、高强度聚焦超声这个骁勇手术做出卓越贡献的猪。
Then I went to ask him about how do you start on your first patients because China was just opening up. And because of the strict laws and regulations, it was very difficult to conduct trials on patients. So it was as last resort that his first few patients with bone cancer approached his HIFU team for help. Now, we know it as HIFU. In China, they call it FUAS, Focused Ultrasound Ablation Surgery. These patients were resigned to face death, then to be amputated. Thus, under such set circumstances, Professor Wang and team agreed to treat them with HIFU. Now you watch the video and observe the moving emotion of a great doctor, his inner feelings, and his gratitude to his patient.
第一例骨肿瘤，第二例骨肿瘤，甚至后面的骨肿瘤，我觉得这不是我们事先想到的。正好他们的家属、他们的父母亲说。 患了骨肿瘤，最后到全中国这些医院跑下来说，只有截肢，而且截肢以后存活多久不知道，因为我们知道恶性骨肿瘤实际上我们一旦诊断80%甚至90%已经有远处转移，所以在这种背景下，这个父母不愿意孩子把这条肢体接了，能仅仅活几个月。他们希望的是，如果能够治疗能够保治，哪怕最后他走了，他是一个完整的人。这在中国的我们叫世俗的观念，是希望孩子是一个完整的，不管生命能不能保得住。所以在这种情况下，全世界在聚焦超声治疗恶性肿瘤里面没有先例，特别是临床治疗这个方面，骨肿瘤就是我们全世界的聚焦超声消融手术的第一例。那么在这种背景下，我们确实取得了成功，因为我们聚焦超声的生物学教育不仅仅是我们以前靠猪靠生物学实验、动物实验室切出来看，而在我们第一例、第二例的骨肿瘤里面，我们一聚焦，啪，这个点呢，焦点的地方在 B 超的灰度上，啪就亮出来了。后来我们总结发现，骨肿瘤是最好的聚焦超声治疗的这个疾病适应症。为什么？因为骨肿瘤里面，特别是我们是成骨肉瘤，那里面有这个骨的成分，可以把超声波的机械波转化成热能，所以很容易看到它的这个强回声的，就是灰阶的巨大的变化。那给了我们全世界这不是给我们信心，是给了全世界这个领域的信心。那么很感谢那些都是孩子，我们有的孩子我们延长了生存期，有的孩子今天哪怕20年以后的今天还活着，而活着的孩子他的肢体是完整的，所以我们怎么说呢？这个技术哪怕有时候看到一个孩子20年前可能我们是要高位截肢，甚至能不能保命我们不知道，而今天他不但保了命，而还是完好的一个人，他没有残疾，他的肢体是好的，还长在那儿，还保留在这儿的时候，我们开心。所以我感恩这些孩子对人类医学的贡献，也非常的感恩我们这个医疗团队让这项技术在这个第一个实验证里面取得了成功。所以第一例、第二例的贡献对这个领域可以说是里程碑式的贡献。
Okay, thank you very much, Professor Wang, and on behalf of the cancer patients, really a big thank you. Let's come back to question and answers. Okay, there's a question from, I think Relly asked the question himself. Every adenomyosis patient always receive combination medical treatment, even for patients who wants to be pregnant. I think this is a question from Dr. Relly to Professor Aixingzi. Well, Dr. Samsu Hadif has a question. He
yes.
raised his hand.
I would like to ask how the recurrence rate, and if the adenomyosis with infertility, how long we can wait for becoming pregnant spontaneously or by IVF?
I think I can give the answer.
Okay.
Yeah. Generally, we always, if the patient won't have the plan to get a baby in the future, so when we treat this patient with, with adenomyosis, we have to protect endometrium. So the lung perfused volume ratio is around 50%. So after that, we just suggest them wait for 6 months to get conceived. So generally 6 months after have treatment for pregnancy.
How about for the recurrence rate, Prof. Chan? recurrence rate of adenomyosis after HIFU?
Yeah, yes, it depends the, classification. For example, like based on the MRI, if this patient with, for example, type 1, like say intrinsic adenomyosis, if they don't want to get if they already complete the childbearing, for this kind of patients, we can completely ablate the adenomyotic lesion. For this type, the recurrence rate is lower, but we don't have the the number for the total patients. Generally, like our paper already for the 2 years, complete 2 years follow-up. So the symptom improvements, symptom relief at the end of 2 years, like around 80%. It means like the 20% may have the symptoms come back after 2 years. Is that your question, right?
Yeah, yeah.
Okay. Okay. So right now, I think also we're working on this for the different type, use different protocol to treat. So in the future, I think probably next year we are going to present the results for you guys.
Okay, I think Dr. Samsuhadi still has a question to ask. Dr. Samsuhadi.
If there is a recurrence, can I do HIFU for the second time?
Yes, for sure. Yeah, because it's a non-invasive. So like I already showed, probably Dr. Lee already knew my first case. The case I treated in 10 years ago. So after the treatment, symptoms disappeared. So 2 years later, she had the symptoms come back again. Then we performed the second session of HIFU treatment, then get very good results with any complications. So because it is non-invasive, for adenomyosis, we can treat it for the second time or third time even.
Okay, can you add to that? Because they're wondering whether after HIFU treatment for adenomyosis, can they get pregnant soon? And secondly, can they have a normal delivery?
Yeah, Professor Zhang Lian answered very well. Actually, I already answered on the WeChat the platform. So it can pregnant easily. I mentioned I have a 45 years old patient. After HIFU, she pregnant 2 times. When she come to me next year, she opened the door and said, "Oh, it's easily to get pregnant. Side effect for HIFU." So she mentioned easy pregnant is one of the side effects. So we have some of patients after 40 years, they have no any plan to have a child again, but after treatment, all of them pregnant. It's like a little bit not very good because I against abortion in China. So we will do good protection to stop the pregnant for some of patients. So not a problem for HIFU patient after 3 months or 6 months. Professor Zhang Lian already answered the question.
No.
Prof. Lee?
Hi, yes.
Prof.
Yes.
Lee, I have to go. I have to go to theater, so I'm going to have to leave.
Raymond, thank you so much for joining us. Thank you so much.
Thank you for having me, and thank you for inviting me to speak.
Oh, don't forget
Bye, Raymond.
South Africa.
Thank you, Raymond.
See you in Soweto, Raymond.
Absolutely.
Come to see you.
All
Looking
right.
forward to seeing you.
Yeah. Goedenavond.
李教授，李清龙教授，你是不是要
Yes. Okay. Thank you for thank you for very good chairman, the moderator of these sessions, and also thanks for the Professor Wang ZhiBiao to have present the so wonderful the HIFU pig and also the bone cancer in treatment by HIFU. And is so impressed. And I have one question for Professor Zhang Lian, because in the if we concern about the same size of the adenomyosis and myoma uteri in the same size, for example, maybe 5 centimeters, the same size. But how about the treatment operation time? Is very compatible between the treating adenomyosis or myoma uteri, or they are quite different? Because as we know, when we treating the adenomyosis, the patient will feel hurt quite a lot. So maybe we will slow down our procedure and our voltages in the treatment. So how about did you have any paper or any data showing about the operation time between the adenomyosis and the patient with the myoma when you treating them, and when which will be more quick and maybe more convenient for the doctor in treatment?
Yes. Dr. Lee, Professor Lee?
Yes.
Yeah. Yes, a very good question. Like I discussed with you before, for myoma, it's much easier for us to evaluate based on MRI to know which one is more easier, how long it's going to take to ablate the tumor. But for adenomyosis, it's much more complicated about this. But anyway, right now I think based on MRI, for example, like the intrinsic adenomyosis, also it's more easier. It's more easier, and also based on the MRI, we can say, like the hypo intensity on T2, and also if we don't say any like the on T2, we didn't say the like the sex or something like that. For this type is also easier. So I mean, MRI is also help us a lot. But I mean, probably next year, I think we can show our data about the adenomyosis different type, how long it's going to take for the HIFU treatment. The solution time, even like something like that.
Okay, thanks a lot. Yeah,
we can do to show you guys.
Yeah, thank you. We learn a lot.
Okay, right on.
Yes.
Okay.
I think we learn a lot from the Professor Zhang Lian. Thank you for your comment. Yeah.
Professor Zhang.
Yes.
Have you performed Doppler blood flow to the uterine, to the uterus before and after your treatment for adenomyosis?
If the patient they don't have the plan to conceive, then we can do this. Yeah, put this in there. After HIFU treatment, we can get this device, put the device in there. Yeah.
No. This is not a device. This is the Doppler ultrasound for blood flow. The blood flow to the uterus.
I'm sorry.
Have you measured their blood flow? Is it better? Does it improve?
Yes, the Doppler ultrasound. Yes, before and during or after, we can use a Doppler ultrasound to check the blood flow. Yes. It works. It's helpful.
It works, yeah. It improves a lot.
Yes.
Yeah.
Mm-hmm.
Thank you.
Thank you.